Welcome back to the Best PT Podcast. This is episode 30, talking about physical therapy legislation. Risk management for legislation. Always have managerial involvement, a proper incident reporting and investigations process, regular inspections, and open communication. Ways to avoid litigation. Always conduct a thorough physical examination, seek consultation or referral if ever in doubt, check your clinic equipment regularly, educate and instruct patients thoroughly, keep the referring physician informed if appropriate. Always obtain written consent for treatment from every patient. Never delegate to unqualified individuals. And keep accurate and timely records. And some legal terms. Abandonment is the unacceptable one-sided termination of healthcare services without the patient's consent or agreement. Administrative law are rules and regulations developed by states and the federal government. Common law are court decisions made by judges in absence of a statutory law. So these are those legal precedences you may have heard about. Constitutional law are laws derived directly from the Constitution. Informed consent is the patient's consent to receive treatment. Informed consent should always be written. Malpractice is the failure to treat as another therapist would treat with a similar skill level and training. And negligence is defined as the failure to do what a reasonable and prudent person would ordinarily do. To prove negligence, a plaintiff must prove that the defendant owed plaintiff a duty, the defendant breached that duty, and that the breach of that duty led to damage of the plaintiff or the plaintiff's property. Risk management should involve identification, analysis, and evaluation of risks. Statutory law are laws enacted by Congress and state legislative bodies. For example, the Americans with Disability Acts is a congressional statutory law. And then a tort is a private civil wrong or injury due to omission or commission of guilt. That's it for episode 30, talking about physical therapy legislation. Episode 31 will talk about delegation and supervision of physical therapy assistants. As always, the outline will be in the show notes. Thanks for joining me.